Hi, this is Amina Sheikh here on etnow.in Business Conclave and Awards 2025. And right now with me, I have Dr. Desai, who is the plastic and cosmetic surgery expert. So join me as I welcome him only on our channel.
Thank you so much. Thank you for the welcome.
Lovely to have you, sir. And I must say that because of you, a lot of people have been gaining confidence. So thanks to you and to the beauty industry that a lot of people are ending for that. But so many times cosmetic surgeries also turn out to be bad on a lot of people, leading to, even like actors, we have seen that when they're coming on screen, leading to a lot of complications. So how do you kind of deal with that?
So yeah, recently there have been certain incidences about, I wouldn't say like a complete negative side, but the other side of these procedures. You got to understand one thing, that for every 1,000 successful procedures, maybe one can have a little bit of a problem, okay? And unfortunately, this is the one which kind of gets blown out in public eyes or media. But those 999 which have been so successful are hardly ever spoken about. But yes, every procedure can have certain risk factors. You can minimize them by proper education and going to the right person. Always find yourself a qualified, board certified plastic or cosmetic surgeon who has studied in this field for a number of years, who has the adequate degrees and is registered with the NMC or with the national board. So that's important. And then your chances are minimized. And the best part is, even if they occur, most of the times a qualified doctor will know how to reverse them.
Okay, that's interesting, sir. But I have to ask you this because in the world of entertainment, there is this requirement to look in a certain manner. How do you cater to actors for that matter, or actresses for that matter, who always have to look their best on camera?
Yeah, see, actors and actresses have a different requirement. It's unique to their profession. You may have an actor who's 50 years, who's who's a hero, romancing a 25-year-old or 20-year-old. So they have to look a little different, or rather than they have to have a larger than life image, and they need certain things which a routine or layman may not require as much. So you have to understand the sensitivity of their profession. Okay, not just think that it is vanity, but it's also the sensitivity of the profession, and according to them treat it. Understand why the problems occur, what issues they are facing when they shoot, and you have to kind of address them. So yeah, they have unique needs.
Also, sir, what made you choose a profession like this, and how early did you start?
Well, actually, I'm from a family of doctors. So both my parents are doctors. Since the time I know, my mother used to keep telling me that you're going to become a surgeon. Okay, so maybe it was psychologically playing on my mind, and but they were very, very supportive. They told me you can do whatever you want and we are with you. They're very, very loving and supportive. But I used to see their life. I used to see how patients respect doctors, the kind of love and affection they get. And I thought, okay, I like this. I want this, at a very young age. So I always grew up, knew that I wanted to be a doctor. Certain thing, probably my mother and father put it in my head. And then when I became a surgeon, I researched, I did more. I was doing cancer surgery for a very long time. I was in Tata Memorial Hospital and actually trained cancer surgeon. But then I decided that, do I want to deal with something else? So let's deal with enhancing people. Cosmetic surgery is not about, we don't call our patients, we call them clients, because they are not sick. They want to enhance themselves. So that excited me, okay? So it's like, I tell them, when you look in the mirror and you think you need a change, even if it's a minimal change, a very small change, and then if I can get that for you and make you happy, and that's what excites me. So that's what drew me towards cosmetic surgery more and more.
That's interesting, sir. But so many times, and we hear these news, we don't really know what exactly goes behind that. But there are so many negative news also which floats around when it comes to cosmetic surgery going wrong, leading to deaths, or leading to certain treatments which people are doing to look ageless. How do you cater to such problems which come into your profession?
No. So maybe if you refer to the recent case of Shefali Jariwala, so I was actually had my 2 bits and I was there on television talking about it. And I said, without even an autopsy, how can we presume? Okay, maybe there was some glutathione tablets or something found there, and that could be in practically every single household. So why presume that this was because of that? So first, get to the bottom of it. Is it actually because of some cosmetic treatment? If it is, then did it happen because of anesthesia complications or another drug reaction, nothing to do with surgery? Okay, first rule out these. You'll be surprised. Then the cosmetic will be way down the list, because complications in anesthesia can occur. You can get a reaction to any painkiller or any antibiotic for the matter, and those can give rise to a lot of problems. So why blame the surgery?
But as you said, like, yeah, she is one of the, prime example right now. Even there have been certain models who just want to look like, there was this one model who tried to look like Angelina Jolie. And unfortunately, she ended up, taking risk to her life and ended her life. Is it also because when you're doing a surgery, it is required not to do one surgery at a time and not multiple, at one occasion?
Yeah, it's interesting. See, anesthesia risk is higher. If the surgery prolongs, those risks become higher, not per se the surgery risk. So yes, that's why you don't want to do too much together. You always tell them to space it out, do little, and that's how you can do it, right? To make it safety. Safety comes first, I agree with you. Safety is primary, especially when it comes to aesthetic surgeries. But you can always do it in stages. You don't need to do everything together at one shot. And that way you will increase the safety levels tremendously.
With the growing demand of looking picture perfect, there's also one thing which has come into picture is about maintaining the natural beauty. And there have been some prime example in recent movie wherein Mohit Suri, a filmmaker, confessed about having his actress as a lead actress for Sayara only because she didn't have much on her face as compared to many of these actresses. So there is some conscious, careful consideration of wanting actresses also to look natural. What do you have to say, and how do you maintain in your surgical process to ensure that the natural tendencies of the features are not basically?
That's a very interesting question, and I'm glad you brought it up. So now understand, I've been practicing for 25 years, and my philosophy always has been, do not change yourself too much. So when somebody comes asking me for a nose job at the age of 40 years, vis-a-vis at 20 years, my approach would be different. At 20 years, I'm okay to do a little drastic change, but that person is still going to come out in his prime. But at 40 years, I said, you live with this nose. People recognize you because of this. So do minimal things, don't overdo it. So yes, you want to do things which are basically minimal. Surprisingly, if you actually dig down deep, everybody's done something, practically, okay? Without any names taken, but everybody has. JD Majetia is a very dear friend, and I can quote him and a patient because he's given me his testimonial. And the first thing, he's done hair with me, and the first thing when he starts with his interview, he was talking to Mumbai Mirror, and the first thing he says was, everybody loses hair, whether male or female. At some age, you start losing hair. So why don't you fix it? And I need something to fix that, and here it is. So yes, people are open about it, but you always look at the age. If somebody is 50 plus, you cannot give him a hairline like a 20-year-old, or you cannot do something so drastic that he doesn't look like himself. You want him to be him, but a better version, a more youthful and refreshed version. So that's what it is,
With technology being so advanced right now that robotic surgeons have come into place, how do you see the entire industry blooming in the next 5 years?
See, robotic surgery as of today, whether you talk about the Da Vinci or any other artist or anything, it's only an aid. It is like an arms, but you control the arms. So it's something to help you. At best, he's an assistant to you. But he cannot replace your thought. He cannot replace your decision making. And whatever goes wrong, if you need to reverse it. Sometimes things don't go the right way, the way you want. But the good part is that you should know immediately how to correct it. And that's why you need somebody with experience. So yes, robotic is good, but it can never replace human skill. Yeah? And especially when the skill involves human hands.
But do you also feel, and in India, which it is good to, if you feel comfortable doing it, but do you feel that the insecurity is at a different level for women out there a lot, because they tend to lose confidence with the comments they receive that they do want to undergo certain procedures. And while the market is very vast and it's a good market to kind of cater to, because it kind of also works for confidence, what are your thoughts on that? Because somewhere there is something which is making them insecure, and that's piling up and it's leading to all these things.
So actually, if you get a survey done, and this is a global study that I'm quoting, when 100 people ask that, do you want to change something about yourself? 95 said yes. So how many said, would you go to a doctor? Only 12% said, I would go to a doctor. And out of that, only 5% wanted surgery. So yes, everybody is bothered. It's just that there are so many fears, there are so many questions, apprehensions. Once we can address them, make procedures friendly, safer, keeping the natural look like you mentioned earlier, keeping the natural look, not changing them too much, clearing myths, okay? There I think media can help, okay? And getting them better, enhanced, then a lot of people would do. And yes, that answers the question that insecurity. So why women? I would even add men to that. If 9500 do feel that they want to change something about themselves and they still are not doing anything, either they are scared or maybe they are just not motivated enough, and of course at some point they're insecure. So yes, insecurity plays a big role there.
And lastly, so I'm going to play a very small rapid fire segment with you, and let's see like where it takes us. The very first question to you is, most popular procedure in your clinic?
Hair transplant, liposuction, body contouring, rhinoplasties, breast surgeries.
Okay. One myth about plastic surgery you would love to bust?
It's only for the celebrities and the rich and the famous. It's absolutely wrong. With the growing middle class, you have no idea how many and who all come to do plastic surgeries.
Okay. Dream celebrity client if you could pick anyone?
Well, am I supposed to answer that, or it's good?
It could be a dream one. So you could just dream about it.
Well, as of today, earlier I would say Chitran Gada, today I would say Tamanna Bhatia.
Wow, nice. And go to stress buster after a long surgery day?
My biggest stress buster is music. So when I'm operating, when I'm traveling, the music is on. When I'm operating, it's a separate playlist. So depending on the surgery I'm doing, I have separate playlists, okay? If I'm doing a surgery which is more labor intensive and less use of thought process, I would have something fast playing like Led Zeppelin or something hard rock. If I have surgery which is like a facelift and I need to concentrate a lot, I would have something very slow going on in the background. 99% I don't even know what goes on. It's just psychology. So, and when I come home, it depends on what kind of mood I am. Maybe it's Lata Mangeshkar or Kishore Da or something like that, or Jagjit Singh for that matter. And it just relaxes my day. Yeah? Even after a big long day like this, if I had to just go home and just listen to music for half an hour, I'm happy.
And lastly, most satisfying moment in your career in a word?
Well, actually, it's actually recently, I was always into academics and teaching to a large extent. I used to teach even during my school days and MBBS days. I used to teach my colleagues and friends and even my juniors, okay? And I would learn a lot by teaching them, okay? So I was selfish also. I would learn also myself. Because when I teach somebody, I need to know it better. So I would always learn, you know, and people used to love the way I teach. So after Corona, after COVID, I pursued teaching to a large extent. I said all the time, I can't sit in my clinic and think of surgery and making money. Let me do something with a passion. And I started teaching a lot. And recently I launched my own global conference, which is happening in September in Goa. So that has, of course, taken a big toll on my health, my time, okay, and my mental peace. But it's my dream vision. We are already tied up with 5-6 global organizations who are into academics. We have so many doctors. Every single top doctor from India is going to be a part of it, okay? And we're looking for more. We have at least 10 people coming from abroad, and we're going to be teaching 500 odd students, okay? What we have learned over the last 20-25 years. So this is something which has really interested me recently.
And lastly, sir, before I let you go, I'm going to ask you this question because that runs in the mind of a lot of people who want to look like a certain actress. How do you cater to such?
That is so difficult. That is so difficult because once they get a picture of somebody, and my first thing is, have you looked at yourself in the mirror? And they say yes. I said, do you look remotely like this? No. I said, tell me what you like about this actress. Is it a chin? Is it a jaw? Eyes? Let's work on you, okay? And enhance the part of that, what you like in that particular person. But don't try to change your face, okay? This is not some serial where somebody becomes somebody else. And that really doesn't happen, okay? You only can enhance your own face, your own structure. And yes, I'll help you out there, but you can't be a different person.
Yeah. Well, thank you so much, sir, for
Thank you
such
so
a lovely insight around the world of plastic surgeries and how to maintain the beauty. Thank you so much. Lovely chatting with you, sir.
Thank you so much. Thank you for having me. It's a pleasure.
Thank you.
If you like this video, then like, share and subscribe to ET Now.